the GI obstructions. Now when you talk about GI obstruction, first of all, before you go to anything else, let us see how we will approach a patient. Whenever you are doing the scan, now when you're seeing the transverse section of abdomen, that is the primary section where we judge for anomalies. What are the normal cystic areas you come across? Stomach, portal vein, aorta, IVC, what else? Gallbladder sometimes, and urinary bladder. These are the cystic areas that we see in the fetal abdomen. Anything additional seen means that is abnormal. One thing. Second thing, whenever I see anything additionally cystic area there, I should look for other organs and then decide what would be the, because once first see what are the normal things seen and then decide what is the abnormal part. Right. So let us start with the basic GI obstruction, starting from the top, esophageal atresia. Now esophageal atresia basically is of two types. Right. One is there is complete atresia, the upper segment of the esophagus has no communication with the lower segment of the esophagus. Then those are just 10% cases. 90% cases, there is upper end is blind, but the lower end of the esophagus is connected to the trachea, forming a tracheoesophageal fistula. So 90% of the cases are tracheoesophageal fistula. The problem that you are going to face now, what way would we detect there is esophageal atresia? Because most cases you don't see the esophagus so well in the fetus. Right? So we cannot just physically go and see and say that, oh no, the esophagus is not seen, so this is esophageal atresia. We get indirect clues. What can be the indirect clues? Whenever there is esophageal atresia, what will happen? The baby would not be able to swallow fluid. Since the baby cannot swallow fluid, what will happen? There will be no fluid in the stomach. Right? So stomach would be not visualized. Or even if it is visualized, it would be very small. Now, in case of tracheoesophageal fistula, what problem may occur? And some fluid can pass through the fistula, the tracheal area, into the stomach. So you may be able to see the stomach. But still the stomach would not be as distended as you see it in a normal situation. Right? So now, since the baby cannot swallow, will there be more fluid outside? Right? So that will lead to polyuria.